Cuboid syndrome is a condition that affects the small bone in the foot called the cuboid. This condition typically causes pain on the outside of the foot, particularly during weight-bearing activities like walking or running. Symptoms of cuboid syndrome may include pain on the outer side of the foot, swelling or tenderness in the affected area, reduced range of motion in the foot, difficulty bearing weight on the affected foot, a popping or snapping sensation when moving the foot. Cuboid syndrome is typically caused by a sudden injury or overuse of the foot, typically an inversion sprain of the foot. Risk factors for this condition may include wearing improper footwear such as worn-out running shoes, participating in high-impact activities like running or jumping, or having pre-existing foot conditions like flat feet or high arches. Being excessively overweight may also be a precipitating factor. To diagnose cuboid syndrome, a healthcare provider may perform a physical exam and take X-rays or other imaging tests such as CT scan or an MRI, to rule out other conditions like a stress fracture or ankle sprain. The problem here is that the cuboid subluxation is so minuscule that it can be difficult to pick up on imaging studies. Treatment options for cuboid syndrome may include resting the affected foot by avoiding activities that cause pain, applying ice or heat to the affected area to relieve inflammation and pain, taking nonsteroidal anti-inflammatory drugs, NSAIDs, to reduce pain and swelling, wearing supportive or orthotic footwear with a built-in cuboid pad to force the cuboid back into position. Taping the foot may also help. Physical therapy to improve range of motion and strengthen the muscles in the foot in severe cases that do not respond to conservative care, surgery may be indicated. The goal of surgery is to fuse the cuboid bone to the calcaneus bone in an effort to stabilize the bone. Complications of untreated cuboid syndrome can include chronic pain and mobility issues, so it's important to seek prompt medical attention if you believe you may be experiencing this condition. To prevent cuboid syndrome, it is recommended to wear properly fitting, supportive footwear while exercising or engaging in high-impact activities. Stretching and strengthening exercises for the feet and ankles can also help prevent this condition from developing. Overall, cuboid syndrome is a painful but treatable condition that can be managed with a combination of rest, therapy, and supportive footwear. Seeking prompt medical attention and following recommended treatment steps can help prevent complications and ensure a full recovery.